So we asked you in the last journal entry, who gets mental illness based on your perceptions? 1 in 5 people will experience a significant mental illness in their lifetime. And by significant, we're not talking about coffee withdrawal or cigarette withdrawal. We're talking about something that most of us would consider a mental illness. Psychosis, mood disorders, eating disorders, anxiety disorders, that sort of thing. Mental illness is not limited to any singular group. The poor, the uneducated, the ill of health, the aged, or any ethnic group are not necessarily more likely to have mental health issues. However, it's important for us to understand that poverty and mental illness are highly correlated. In other words, in the group of people that we would call under the poverty line, there's a higher than normal prevalence of mental illness. The evidence suggests that the poverty is not causing the mental illness, but that the opposite is likely the case, that people with mental health issues that are not treated or they're chronic and unsuccessfully treated may be less likely to find adequate incomes or adequate housing, and these things can cause the person to live that impoverished lifestyle. Mental illness is not evidence of immoral or foolish behavior any more than a person having a physical ailment like the flu or cancer is a sign that they've done something morally wrong. Now, most people will obviously know this. However, it's important for us to understand that, particularly in some cultural groups, this is still a prevalent idea that a mental illness or even a physical illness comes as a result of a person or of the person's family having done something morally questionable. The truth is that mental illness can happen to any person at any time. The other question we asked you is, what were the prevalence of mental health disorders? What did you guess? And let's take a look at this. These statistics are from the Public Health Agency of Canada, and what they estimate is how many people in a given year are likely to have one of these types of disorders. And mood disorders is one of the more prevalent ones, between 5.1, 1 in 20 people, and 8.3, 1 in approximately 12 people in the population, and any given year would experience a mood disorder, according to the Public Health Agency of Canada. And of those mood disorders, I can tell you the single most prevalent one is what we call major depressive disorder, single episode. So the person would experience the signs and symptoms of depression for at least 2 weeks. Schizophrenia, by contrast, is far less common. Less than 1 in 300 people would experience symptoms of schizophrenia, and yet, if you were to pay attention to what was going on in the media, you might be convinced that it was a far more common disorder. The single most common disorder these days is anxiety, or are anxiety disorders, and this is a fairly broad category. It includes phobias, acute stress disorder, post-traumatic stress disorder, generalized anxiety disorder, obsessive compulsive disorder. And you can see that approximately 1 in 8 people can experience an anxiety disorder in any given year. That doesn't mean they're all going to seek treatment. In many cases, people would simply adjust their lifestyle. And you might also be interested to find out that anxiety disorders have begun to eclipse mood disorders as the most prevalent disorder that's being registered today. And that may be because people are more sensitive to anxiety or are under more stress. But there's also a high likelihood that it has to do with people returning from war, where post-traumatic stress disorder incidences are very high, and so this has elevated that number. Personality disorders are estimated at 6 to 9% of the population. Now, they're estimated because it can be very difficult to detect personality disorders. Eating disorders, while they get considerable amount of press, are far less common. But still, for women, you can see the incidence at 2.2%. Approximately 1 in 50 women in any given year might have an eating disorder, such as bulimia, anorexia nervosa, or compulsive eating. Men, by contrast, are far less likely to have an eating disorder at only 0.3%. Deaths from suicide, described by Public Health Agency of Canada using statistics that are a bit old, 1998. But I think it's a safe assumption that the numbers still tell an important story. Approximately 12.2 people out of every 100,000 in 1998 committed suicide, and that accounted for 2% of all deaths. What's interesting is that even though out of all deaths, only 2% were accounted from suicide, 24% of the deaths in people between the ages of 15 and 24 were from suicide, and 16% of all deaths from those 25 to 44 were accounted by suicide. So you can see that suicide is a major cause of death to this day for younger people. And we talked earlier about the onset of mental health disorders in our early adulthood and our youth. And you can see there's a correlation between those deaths and that onset of mental health disorders. By the way, we can also talk about the statistics for suicide by looking at certain populations, certain geographical areas, and poverty levels. And what the evidence shows is that the incidence of suicide goes up when people live in remote communities, when people are of First Nations background, and when people have drug or alcohol problems. And guess what? There is no single higher level of suicide than in remote First Nations populations where drugs and alcohol or inhalants such as paint thinner are commonly utilized. And it is indeed the number one killer of young people in some of those villages and reservations. And the frequency can be as many as 1 in 8 people can be killed by suicide in any given year. Before we move on to the next slide, just a quick review. We want to talk about the idea that 2 of our most common disorders are identified here: mood disorders at 8.3% and anxiety disorders at 12.2%. Those are 2 of our 3 most prevalent disorders. And again, mood disorders, we would typically think of clinical depression as being, or major depression, being the one that was most common in that category. We also can talk about the prevalence of addiction. 1 in 10 Canadians 15 years of age and over report symptoms consistent with alcohol or illicit drug dependence. So this is our 3rd most prevalent mental health disorder. So our 3 again were addiction, mood disorders, and anxiety disorders. 3.8% of adults are classified as having moderate or severe gambling problems, which is another form of addiction. And about 20% of people with a mental disorder have a co-occurring substance use problem. We talked about this earlier, that approximately 1 in 5 people who have a mental disorder also have a substance dependency issue. Men are 2.6 times more likely than women to meet the criteria for substance dependence. And by the way, the most commonly used substance is still alcohol to this day. And these come from the Center for Addiction and Mental Health. They're very recent statistics from 2013, and this is a Canadian institution. Let's go back to our journals. What does mental illness look like to you? Using your journal and a timer this time, list as many mental health symptoms as you can in just 2 minutes, and if you have a partner, compare your results when done. Which of these symptoms do you understand well, and which do you need to understand better? In our next section, we'll look specifically at some common mental health symptoms.